Good afternoon, countrymen. I'm Dr. Kasliwal from the Medanta Heart Institute. I chair the Department of Clinical and Preventive Cardiology, and it's my honor to be speaking to you. Dr. Trehan had an emergency in the operating room, which is not uncommon in our lives, but so he had to leave. Well, I hope to fill that gap and take you through some of the things which are. Firstly, it's important to understand that cardiovascular disease in our country is it's an epidemic. Please understand that there's a depth of the word epidemic, that every 1 in 10 individuals over the age of 30 or 25 now has a chance of getting a heart attack or a stroke. Let me clarify right here that females feel that in the years of menstruation and all that they are safe from it. This is far from the truth. It is an equal opportunity killer in the sense that it will affect caste. It doesn't matter about caste, creed, gender. But across South Asia, we are a region which has the highest numbers of heart attacks, what we call as STEMIs. We were participants in a study called the CREATE study, and that demonstrated that 60% of world's heart attacks, the STEMIs take place, ST elevation of heart attacks take place in our region, in India particularly. What is the real, why do we keep talking of STEMIs or heart attacks? Because in this situation, as opposed to unstable angina or non-STEMIs, 30% or 25 to 30% of individuals will not get a second chance to actually get up from the floor and say, look guys, can you do something for me? I'm having a heart attack. So that is the importance of this term ST elevation myocardial infarction, which is known colloquially as a heart attack. Having said that, it was not my purview to really go through, bypass surgeries and angioplasties, those processes. But I did think that on this World Heart Day, and I always feel that the World Heart Day should be around, every day in India should be a heart day because of the younger and younger people getting affected by it. But I did want to discuss with you some of the risk factors which can directly, indirectly cause heart attacks or strokes. Now, many of these things but I would just reiterate that smoking, high blood pressure, diabetes, high cholesterol, then we have a peculiar type of high cholesterol in our body in which the triglyceride levels are high, LDL levels are high. So that's the fourth risk factor. And then we now have what we call as obesity. That's an important risk factor. We have more and more common that people just spend time changing channels rather than actually going out to play. And of course, one thing which is extremely important is that everybody is stressed. So these are the lifestyle diseases. So these are the 7 or 8 risk factors which predispose us to a heart attack. One of the things that come out here is that if you have a family history, meaning thereby that if you have a single parent or both parents or your brothers or anybody who's had a heart attack, and that predisposes you to a not 4%, but makes you 4 times more likely to get a heart attack or a vascular event of any kind. So these are the risk factors that we have to understand clearly. Amongst the younger people who come to my emergency room and whom we see on an everyday basis and do primary angioplasty on, are people who have been smoking and or abusing nicotine. These are 2 things which are a big risk factor in our country. Also, we are the diabetes capital of the world. I mean, this ball keeps changing between China and India, but however, we do have a lot of diabetics, and diabetes, sugar disease, predisposes us to early heart attacks. One thing which we always underscore is the presence of high blood pressure. People take it very lightly. Say, okay, it doesn't matter, it's 150/90. But high blood pressure is a very common cause of strokes, that means brain strokes and heart attacks. It's the #1 public health problem. To these 4 conventional risk factors, which were defined as far back as 1948 by William Kennel in a small town in America called Framingham, just out of Boston, we have the newer risk factors like stress, we have obesity, we have sedentary lifestyle. So these are some of the factors which cause or predispose us to heart attacks. It is important. So we have a formula. So I made you aware of what the risk factors are. So I have a formula called ASAP. ASAP. In ASAP, what we say is that A is the awareness. So with this interaction and also reading papers every day, you are aware that as Indians, we are at a very high risk of getting heart attacks. If we have any of these risk factors that I have defined to you, we have very high chances of getting heart attacks. So the #1 thing is awareness. And of course, there will be lots and lots of people who have none of the risk factors. So that's fine. I mean, they don't have to really worry. So the first thing is awareness. Once you are aware that, yes, I've been smoking some, or I'm obese, I've got metabolic syndrome, and then what you can do is get yourself screened. And the screening it's simple. They'll take your blood tests, blood sugars, they will take your blood pressures, and do whatever relevant tests are required. So that's the screening part. So once you're aware, A, once you have screened yourself, S, then you take action. What can the action be? Definitely lifestyle, definitely diet, exercise, and sometimes your doctor may say, look, sorry, we'll have to just give you some medication because the factors are so abnormal. So then you say ASA, if we follow that, then we can prevent and predict. So that's the formula of ASAP, which works out very well. Now many people say, when should I get my first check? What we are saying now, men over 25, women over 30 should have their first, at least a basic heart check to define what their risk factors are. And so once you know that, then you can take action. You'll be surprised, and gladly surprised to know that in many Western countries, where heart attacks, heart disease was still the #1 killer, their graphs are actually coming down. So which means that by public education, these forums which have been provided, by which we are interacting, we can really take that in real life and really prevent. We, of course, in our country have the superpower of yoga, meditation, and to that if we add exercise, then we are sitting on a situation where heart attack should actually be decreasing. So my message to you on the World Heart Day, I would say no to smoking, say no to salt, say no to high blood pressure, no to sedentary lifestyle, no to saturated fats, the usual things that we all do in real life. Yes, we snack a lot, we put a lot of salt. Salt causes hypertension. Hypertension is one of the causes for coronary artery disease and also stroke. So this is what I had to say. If you have any questions.
Now, one of the questions from Anand Kalapam is, most of the people get heart ailments after 30. So can we know why any do-it-yourself simple methods and checks to find whether our heart is in good shape?
I have already answered that question, that if you apply the formula of ASAP, and if you are at risk, you should definitely get yourself checked up. You must have a screening done, as I've said. Men over 25, women over 30 should have their first check. And accordingly, your physician will decide, should you have more regular checks, or you can come after 2 years or so. And if there are any abnormalities in the blood, any abnormalities in the blood pressure, he will define to you.
Another question is, will I be able to recover my normal work life if I undergo heart surgery?
A very emphatic yes. If it has been done in time, you've reached, the heart function is well preserved or not so well hit, you will be able to reach life. There have been many people who have been presidents of great countries after their bypass surgery, so have no problem on that count. But again, I said, why should you reach that stage? You should be able to prevent it.
Why are cardiac diseases so prevalent in India? Why only India? What can we do to change the scenario?
Yes, that's a good question. But let me tell you, across the board, cardiovascular diseases are common in every country. And in most countries, let's not use the word, in most countries, cardiovascular diseases are very common. But people have, over the last 60 years, realized the value of risk factors, early detection, and have changed the course of the disease. As you know, prevention is better than cure. Everybody knows that. As far as India is concerned, again, a very good question. It's in epidemic proportions because of our unhealthy lifestyle. Not enough exercise, eating saturated fats, not caring about high blood pressure and sugar, and smoking. These are some of the factors which make us very, very prone to heart attacks and strokes.
Is taking an aspirin or Diagene during chest pain the right course of action?
Yes and no. If you were having chest pain, which was almost like a heart attack, but the disease was something different, for example, dissection of aorta, not uncommon, then by taking an aspirin, you've taken away the chances and you may be in serious trouble. As far as Diagene gel is concerned, I don't know what it will do in a heart attack, but if you're feeling acidic, you can take it. But if an ECG has been done and you're traveling in an ambulance, they've already done your ECG, sure, they'll give you a sorbitrate and an aspirin, no problem then. Once they've established that this is either unstable angina or heart attack, you can take it.
I was a chain smoker. I quit smoking 5 years ago. Should I still worry?
Well, if you've been a cigarette smoker, at least you should do basic tests to find out if smoking has left any stigma into the body. Like you can do a carotid scan. If the carotid scan has come back to normal, you can do x-rays. Generally, it takes about 8 to 10 years for the hemodynamics to come back to normal. So I think you should take all care.
As a professional in our 20s with a hectic lifestyle, what precautions do you suggest to prevent heart issues?
Yes. 3 or 4 things actually. Excuse me. Most importantly, see, it's not only you who has a hectic lifestyle. Everybody else also has it. So I think you have to time manage yourself so that you give some time to your body in terms of exercise, physical exercise, little yoga and meditation. That's one part of it. But secondly, also look at the diet that you're taking. Very, very important. Saturated fats and salts can do havoc to your body because they will accumulate and will cause a problem in 10 years, 15 years. So there is no problem in being ambitious. There's no problem in working 12 hours a day, but you have to look after your exercise patterns. You have to see that you don't put on weight around the abdomen, what we call as the bear tummy or the metabolic syndrome, and look after your. But also, it is important that if you have such a hectic lifestyle, it may be a good idea to just check out once. What are my blood sugar levels like? What is my cholesterol levels like? What is my body mass index? These things can immediately tell your doctor or your physician, hey, look, better take care. So if you look after yourself, you can have a hectic lifestyle. It doesn't really matter.
Does the quality of food also impact heart issues?
Yeah, absolutely. That's what we have been talking about. High saturated fats and high salt intake will definitely impact.
It is the quality, the adulteration part of it. Additives, preservatives.
Yeah, of course. Preservatives have salt. Preservatives have oil. So they'll hurt you bad.
how often should one undergo angiographies if they are already being done, already been detected with a blockage in coronary artery, apart from controlling cholesterol and keeping blood pressure in control?
No, I think you mean a CT angio. How often should you have? If your CT angio shows minimal blockages and you're doing exercise, then you can follow that up with exercise tests to see that blockages have not increased. But leave that decision to your cardiologist. If he thinks that there is a change in symptoms, change in ECG, change in your stress test, he will tell you that, look, this is the time to do it again. But generally, I've seen that once a person has had an angiogram, he's been detected to have non-critical diseases, people change their lifestyles. I mean, people are, they know that, look, why should I get a heart attack? So they'll change. But it's a decision by the cardiologist. Sometimes we don't do an angiogram in 10 years. Sometimes you say, look, 6 months, you've been abusing yourself, just do it.
There is another question from Vaibhav Dwivedi. He asks, in what ways does the stress contribute to CVDs?
Oh, directly. Stress contributes to cardiovascular disease directly because it causes increase of adrenaline, noradrenaline in the body. These are bad hormones, and they internally raise the blood pressures. They mobilize the cholesterol levels. And you've seen some Hindi movies of the past now, that somebody gets a phone call and says, oh, what happened? He drops. But that's exactly what can happen, because you immediately raise your blood pressure levels and you can rupture a plaque in the coronary arteries or equally in the brain arteries. So both acute stress as well as chronic stress is important. Now, I don't mean, when we're talking of stress, I don't mean that all stress is bad. Some stress is good because it spurs you for higher things. Like, for example, a child going for his class 12 examination cannot go whistling on the streets. He's stressed. But his body is honed to his paper. He understands exactly, his heart rate will be higher. His BP may be higher about 5 points or so. But he knows exactly, so that when the exams are over, then he is fine. So that's, in a sense, I don't want to call it good stress, but what I'm saying is that yes, there is both good stress and bad stress. And in moments of, like if you're asked to speak something suddenly, or you have a sick patient, of course, you cannot be normal. And that's what happens in our lives as well all the time. It's how you take it. If you internalize your stress, you're in trouble.
Prem Reddy is asking, how to educate people in rural areas about CVDs and create awareness among them?
From the year 1994, we've run a program called the Community Outreach Program, where we have gone to places, far out places, all across North India, up to Kabul, Afghanistan, and Kathmandu. And I've realized that actually village folk are not averse to understanding that heart disease is taking place there as well. Diabetes is common, hypertension is common, and smoking is common. It may not be smoking from a cigarette or a bidi, but they inhale the way our rural folk cook. Now of course things have changed, but they inhale a lot of smoke. So, but you are going to the rural areas. What I'm saying is, even in the urban areas, there's hardly any, the heart attacks are rife. They're absolutely very, very common. But yes, we should take it to our rural folk too. And Medanta has been doing it for the last 20 years.
The next question is from Namrata Suryavanshi. So the question is, do you recommend self-monitoring of blood pressure devices in the market?
No, if you are a blood pressure patient and if you're on medication, self-monitoring is supposed to be extremely good. It's called home blood pressure, and all across Europe at least, it's a big thing. People say that the pressures measured in the home is actually the best pressure, is the correct pressure, sorry, not the best, it's the correct pressure. Because when you come to a doctor's office, you may abnormally get rise in the blood pressure called the white coat hypertension. But if you're in your home, that will be the time. If you are still a high blood pressure patient, then you should be on treatment both by lifestyle as well as by medication. So home blood pressure monitoring is good, extremely good. We do this ambulatory BP monitoring, and many times you realize as soon as the patient goes out of the hospital and is sitting at home or with his family, the pressures are down. So it's the same thing. So if you ask me in one sentence, home blood pressure, correctly taken, correct position you are sitting in, not with cell phone in one hand and somebody talking to you. If you are quiet, you put your hand on the table, you expose your upper arm, tie the cuff correctly. Yes, home blood pressure is very good way of monitoring your blood pressure.
Srikant K is asking, would you like to recommend any books similar to Dean Ornish's Reversal of Heart Disease, which gives details about Indian foods?
Oh, there are plenty of books. I don't remember offhand which author, but there are plenty of books which will tell you about reversal of heart disease and about diets that you should be taking. I'm sorry, often I don't remember.
I think we'll take one or two more questions.
Sure.
Dr. Bhupendra is asking, in case of valvular surgery in young PT tissue, valve is more preferable?
Generally, in young people, they will put mechanical valves. However, if it's a young lady who is going to get married and is going to bear children, then they'll put a bioprosthetic valve. And then, hopefully after her family is done, the children have grown up, she may require a second surgery. So in young, generally up till now, mechanical valves, and in the middle age and above, they'll put bioprosthetic valves.
So although we've covered these questions, this question is for Reha. What are the major factors as to why the percentage of heart strokes not decreasing in our country?
No, on the other hand, they are increasing. And I've already defined to you that this is a lifestyle disease. If you don't look after yourself, the numbers will increase. And that's what it is happening. That with the onslaught of smoking, high blood pressure, diabetes, sedentary lifestyle, it's on the rise. But there are countries who are able to control it, where the heart attack rates are actually going down. We should take a cue from them.
This one is from Srikant K. Do you think alternative medicines, Ayurveda or yoga, can play any role in prevention of heart diseases?
Sure, absolutely. I've been talking of yoga and meditation all throughout, and physical exercise. Don't forget the true value of physical exercise. It decreases LDL levels, it increases HDL, the good cholesterol levels, and it decreases the blood sugar levels. It provides collaterals formation in the heart and brain. So nobody can underscore the true value of yoga, meditation, and physical exercise.
This is from Avinder. Would you like to recommend any do's and don'ts for the diet, particularly for keeping healthy heart?
Yeah, I've said one of the 6 S's. No, one of the S's is say no to saturated fats. See, we have this impression that if we are going out and we go to one of these famous chains, that food is bad. I will not comment on that. We all know what it is. But we may be doing enough damage at home in many ways. Number one, while talking to patients whose blood pressures are not settling down, I was once asked many years ago, do you put salt in your atta? In chapat. And the people, many families still put. How can you ever control your blood pressure? So this is an important thing in diet. The other thing is that always a myth comes around that pure ghee is good. I'm not again going into that controversy. But if you take oils which are high in mono, unsaturated or fats, low fats, that's the best way to do it. So then we are not eating enough vegetables. Can you imagine? Data shows that we are not eating enough vegetables in our country. And we should take fruits and yes, some 8 or 10 nuts and 2 walnuts. Excuse me. All these things are very good in diet. it should be followed.
Manish is asking what top 3 technology solutions that startups can focus on developing and are the need of the PTS.
Please say again.
I mean, what are the 3 technology solutions that you recommend for the startups who are coming up in healthcare sectors?
No, I think one of the startups that has come, and it's already very, very common, is the startup for exercise. Have I done 10,000 steps in the day or not? See, everything people say 24 hours, but nothing is 24 hours. It's only 12 hours. Have I done 10,000 steps or not? How many? So that you may start up or not, it's already there. The other thing which you can really do is for people who have high blood pressure or people who have high lipids. They don't have to go to the doctor again and again. They can give them a value of their high blood pressure by home monitoring for a week or so, and the doctor's assistant sits down and says, well, we gave him this medication, it's not working, or it is working. So there is a lot that you can do electronically. It's just started. It's just started.
We will take the last question.
Sure.
This is from Vivek. Journals mention about the side effects of statins. Should they be taken lifelong?
No, these are 2 different questions he's asking. There is nothing in the world which doesn't have side effects. So do statins. But singly, probably, it is one group of drugs that has saved maximum number of lives across the globe. Now, if you have had an angioplasty or a bypass or you're at higher risk, and if your doctor, after reasonably good thinking, has started you on a statin, naturally protection should be lifelong. So this answer would say, logically, it would be lifelong. And that's what we are doing with most of our patients. But with patients who just have risk factors and those risk factors are not totally controlled, that's an individual decision between the patient and the doctor. That look, should I continue or not continue? But yes, every drug has side effects, please. There are new drugs coming up in this field, PCSK9 and already coming up, which might decrease the influence of the statins that they have as of now. But before we end, one thing I would say for our younger people, that it's not cool to smoke. Many people think so. Number 1. Number 2, if you're not smoking, but you're passively smoking, even that is bad. It also predisposes you to getting clogged arteries. And then, of course, I've discussed at length about high cholesterol, high fat diets that we eat, lack of physical exercise. These are things which are well known. They come every day. There's one article or the other. It's a question of saying that, okay, on World Heart Day 2015, I know that out of these 8 risk factors, I have 2, 1, none, and I will go accordingly. That's what I would say. Is that the last question? Yeah. Thank you. Thank you, ladies and gentlemen.
Thanks so much.
No problem. This is my field here. You wake me up at 2 a.m. and I'll give you.
No, but it's a really, we apologize.